talk about talocalcaneonavicular joint. We are already in the joints of foot. So we have seen the subtalar joint. Now today we will see talocalcaneonavicular joint. So as the name suggests, this is the joint between talus, calcaneus, okay, and navicular bones. So this is a joint that connects talus, calcaneus, and navicular bones. Okay, right. So this is complex joint comprising of two articulations, right? The anterior part of subtalar joint. Welcome Akshaya and Nazina. Okay. So the complex joint is comprising of two articulations. Anterior part of subtalar joint, okay, subtalar joint, okay, and the talonavicular joint. So when we say talocalcaneonavicular joint or TCN joint, okay, it is comprising of two joints, subtalar joint and talocalcaneonavicular joint or talonavicular joint. In the subtalar joint, the anterior part of subtalar joint participates in the joint formation, thereby forming the articulations, right? Again. Right. We'll see this in a minute. Okay, this is calcaneus. This is the real subtalar joint. Okay, subtalar joint. So subtalar joint means below the talus. This is also subtalar joint, but this articulation is different from these articulations, right? Because the articular surface is of talus, whereas the anterior and this is the posterior articular surface, whereas this is middle and anterior articular surfaces, right? So this is calcaneum, this is sustentaculum tali, this is articular facet for cuboid, right? So the entire space in the red and white, okay, this is what we call as TCN joint, right? The whole white space, okay. Talocalcaneonavicular joint, right? Okay, this is the posterior articular surface, anterior and middle articular facets for talus. Okay, this is calcaneum, posterior articular facet, anterior and middle articular facets, right? Right. So this is subtalar joint. right? So these articulations, this articulation, this is sustentaculum talae, ST, right? Articulates with these articulations, right? Under surface. Okay, this is talus. So there will be a gap between, though we call it as talocalcaneonavicular joint. Okay, there is no direct connection between calcaneum and navicular, right? This is navicular bone, this is calcaneum, and this is talus. So when we mean the talocalcaneonavicular joint means this articulation, that means head of the talus articulates with the navicular bone, right? This is the head of talus articulating with the navicular bone. So, okay, and there is a ligamentous connection, right? Ligamentous connection between calcaneum and navicular bone, right? So the filling of the gap between talus, calcaneum and navicular bone. So this is called as spring ligament. Spring ligament complex. Okay. So this spring ligament complex, okay, supports the head of the talus, right? Okay. Head of the talus is supported by the this spring ligament complex. Okay. This is the talocalcaneonavicular joint, right? Talocalcaneonavicular joint. Calcaneonavicular joint. This is how the joint forms and helps in eversion and inversion of the foot, because the subtalar joint, the whole of subtalar joint helps in eversion and inversion of the foot. Okay. Whereas the supratalar or talocrural joint helps in dorsiflexion and plantar flexion of the foot. Okay, these are dorsi and plantar flexion of the foot, whereas the whole of this subtalar joint helps in eversion and inversion of the foot, right? Okay. Okay, so this is the space. Talus will be, head of the talus will be supported by spring ligament. Okay, so what are the articular surfaces? Articular surface, the ovoid talar head is continuous with the triple faceted, right, anterior area of its inferior surface. Okay, so talar head of the talus, which has articular surfaces. This part fits the concavity formed collectively by the posterior surface of the navicular joint, middle and anterior talar facets of the calcaneus, and superior fibrocartilaginous surface of the plantar calcaneonavicular ligament, which is also called as spring ligament. Okay, so the head is fit into the this concavity formed by the articular surfaces and the gap between the calcaneum and navicular bone, which is filled with spring ligament, right? The bones are connected by a fibrous capsule and by the talonavicular ligament and plantar calcaneonavicular ligament. The calcaneonavicular part of the bifurcate ligament, right? So we'll see this bifurcate ligament in the next section, right? Next bone, we'll see that completely. But we have two ligaments in the TCN joint. They are talonavicular joint that connects between talus and navicular bone, and there is plantar calcaneonavicular joint. Okay, plantar calcaneonavicular joint means the ligament, okay, which fills the gap between these two, right? Okay, this is the plantar calcaneonavicular ligament. Right. The capsule is poorly developed, remember that, except posteriorly where it is thick and blends with the anterior part of the interosseous ligament filling the tarsal end. So the fibrous capsule of the TCN joint is blends with interosseous ligament, right? Remember that. Coming to the ligaments, there are two ligaments, talonavicular joint ligament and plantar calcaneonavicular ligament or spring ligament. So spring ligament is nothing but plantar calcaneonavicular ligament. Okay, so basically we have navicular bone, calcaneum and talus. Okay, so the ligaments exist between these two. This is talonavicular ligament, and the ligament between these two, right, is spring ligament. That's it. Coming to the talonavicular ligament, the talonavicular ligament is a broad, thin band connects dorsal surfaces of the neck of the talus, okay, and the navicular, and is covered by extensor tendons. Okay, remember that it is covered by extensor tendons. So the neck of the talus and navicular bone is connected by talonavicular ligament, right? The plantar calcaneonavicular ligament and the calcaneonavicular part of the bifurcate ligament are the plantar ligaments of the joint, respectively. Okay, we'll talk about that. Although the calcaneus and navicular do not articulate directly, they are connected by the calcaneonavicular part of the bifurcate ligament and the plantar calcaneonavicular ligament. Okay, we'll talk about that. Okay, this is the calcaneonavicular ligament. Okay, so red one is the talonavicular ligament, right? Observe everybody, calcaneum, sorry, talus and navicular bone, right? You see, this is the ligament, right? Talonavicular ligament, right? Observe this talonavicular ligament. Coming to the spring ligament, right? Plantar calcaneonavicular or spring ligament is a broad, thick band connecting the anterior margin of the sustentaculum talae to the plantar surface of the navicular bone. So it is a connection between sustentaculum talae and the navicular bone, the plantar surface, right? Plantar surface of the navicular bone, under surface of the navicular bone. That is very important because that is why it is called as plantar calcaneonavicular ligament. It ties the calcaneus to the navicular below the head of the talus as part of its articular cavity and maintains the medial longitudinal arch of the foot. We haven't yet discussed the arches of foot, okay? But remember this point, okay? Spring ligament forms the medial longitudinal arch of the foot, right? It is made up of two distinct fibers, superomedial portion and inferocalcaneonavicular portion. The dorsal surface of the superomedial calcaneonavicular portion has a triangular fibrocartilaginous facet on which part of so the part of the talar head rests on superomedial calcaneonavicular portion. The plantar surface is supported medially by the tendon of the tibialis posterior. So this ligament is partly supported by tendon of tibialis posterior and laterally by tendon of FHL, flexor hallucis longus, and FDL, flexor digitorum longus. And its medial border is blended with the anterior superficial fibers of the medial deltoid ligament. Okay, so its medial border is continuous with the or blends with the deltoid ligament, and the transaction of the spring ligaments leads to the instability of the hind foot, including talar head, plantar flexion and adduction, consist with pes plano valgus. Okay, right? This means flat foot. Okay, we'll learn about this more in arches of foot, right? The clinical anatomy of arches of foot. So basically this spring ligament, which is has superomedial and inferior calcaneonavicular portions, are supported by tibialis posterior and FHL and FDL, and some part of it blends with the deltoid ligament, right? So you see, this is the posterior facet, talar facet. Okay, this is for body. Okay, so talus fits like this. Okay, this is the spring ligament. Okay, this one connection between sustentaculum talli and navicular, right? Okay, this is the spring ligament. This one is the spring ligament. Okay, you see clearly there is concavity forms by the articular facets, and right, that is spring ligament. Okay, spring ligaments arches from here to here, right? So this is the superomedial portion and inferior portion, plantar portion, right? Medioplantar and inferior plantar portions. Inferior part is again divided into like this. This one is superior medial portion. Observe that carefully, right? So this is calcaneus. This is navicular bone, right? This is cuboid. See, from sustentaculum talli to navicular bone, you see this spring ligament. Okay, these are the superomedial, and this is medioplantar, and this is inferoplantar, right? See, tibialis posterior. Okay, this is superomedial spring ligament, superomedial portion. This is medioplantar, inferoplantar, and this is superomedial, right? Again, this is the spring ligament. Okay, this one here. see, what is that? So this is the spring ligament. You see, the entire concavity is formed by spring ligament. All sort of fibers, medial calcaneonavicular, inferior medial plantar and inferior plantar, all of them, okay, forms the spring ligament complex, right? Observe that carefully, okay. See, the plantar calcaneonavicular ligament from the plantar aspect, okay. The whole of this is from the plantar aspect, okay. This is the spring ligament within the green box, right? Seen from below. You see, the spring ligament connects plantar, as this is the plantar, right? This is the spring ligament, right? Observe carefully, blue one, okay? That is why we have a arch like this, okay? That is called as arches of foot, one of the arches of foot. So when this ligament was torn, okay, there is no, uh, okay, this was torn. Then what will happen is talus will be displaced, okay? So that is called as flat foot, right? Okay, you see, displaced talus, our words will be like this, right? Okay, this is acquired flat foot. Synovial membrane, which is synovial joint whose cavity sometimes concurrent that of talocalcaneal ligament joint, right? On the medial side from dorsal to plantar, that means from above, from dorsal to plantar, tibialis posterior, FDL above the sustentaculum tali and flexor hallucis tendon below the sustentaculum tali, ST, okay. So sustentaculum tali above is FDL, below is FHL. At this point, remember, flexor hallucis longus lies deep to the medial and lateral plantar branches of the posterior tibial artery and tibial nerve. Remember that, okay. Dorsally, right, from medial to lateral, tibialis anterior, EHL, okay, deep fibular nerve, okay, and dorsalis pedis artery. This is from medial to lateral. Most medial is tibialis anterior and EHL and deep fibular nerve and pedis artery. Muscle belly of extensor hallucis brevis passing medially and deep to tendon and fibularis tertius. Maintaining stability. Stability is combination of factors because of the bony contours and the concavity, because of the spring ligament and bifurcate ligament. Because of the ligament structures, this is well stabilized, right? So that is talocalcaneonavicular joint. Okay. We'll see the 3D anatomy of it, right? So you see, this is the foot, right? Okay. Okay. Thus, that is talus, and this is navicular, and this is calcaneal. Okay. So that is spring leg. I'm sorry. that is spring ligament, right? The blue one, right? And if we, okay, that is spring ligament, right? And this one is talonavicular ligament, right? Talonavicular ligament, that is between talus and navicular, and this is spring ligament. You see, spring ligament supports the head of the talus, right? Okay, see, that is defibrillator now. Okay, we just discussed about it. Okay, medial and lateral, and this is the defibrillator nerve, right? You see the relationships. Okay, this is tibialis posterior, this is flexor digitorum longus, and that one is flexor hallucis longus. So those are, you see, here it is represented wrongly. Okay, rightly, correctly. FHL is below the sustentaculum talus, right? So that selected structure is FHL. This is FDL. This is tibialis posterior, right? You see, this is the bifurcation of posterior tibial artery as medial plantar and lateral plantar arteries, right? You see, that is FHL, right? We learn about something, okay? Bifurcation of medial and lateral plantar arteries. FHL lies deep, right? That is the structure there, right? You see? Flexor hallucis lies deep to the medial and lateral plantar branches of the posterior tibial artery and deep, right? So this is the bifurcation of posterior and medial and lateral plantar arteries. Okay, this is FHL. Always remember. Okay, this, you always remember this part. Okay, this is tibialis posterior. This is the tendon of flexor digitorum longus, and this is the tendon of flexor hallucis longus. Right? Okay, and here we'll see the dorsalis pedis artery, and we'll remove this retinaculum. Okay, this is tibialis extensor hallucis longus (EHL). Okay, this is EDL. Okay, extensor hallucis longus. Okay, right. So this talonavicular joint has connection with dorsalis pedis artery, right? Very close to the dorsalis pedis artery, right? So we have, that is spring ligament, that is talonavicular ligament, and you see, this is the deep peroneal nerve. Okay, deep fibular nerve or deep peroneal. So deep peroneal and dorsalis pedicatry is in relation with, you see, so dorsalis pedicatry and deep peroneal nerve. Okay, this is the deep peroneal nerve. Okay, deep fibular nerve. Right, they are in relation with the TCN joint, right? And always remember the tendons of passing like this: tibialis posterior, flexor digitorum longus, and extensor hallucis longus, flexor hallucis longus, right? That is the lesson. We are done with the lesson. So if you have any doubts, let me know.